You may be familiar with rating symptoms on a checklist already. Usually, checklists take the form of rating a symptom on 4 choices, such as 0, it happens none; 1, it happens a little or is mildly distressing; 2, it happens often or is medium distressing; 3, it happens a lot or is severely distressing. The 0s, 1s, 2s, or 3s are added up for each symptom to get a total score. There are many of these types of checklists published. Some of them assess only the 17 symptoms that are used in the diagnosis of PTSD. Some of them ask about other types of symptoms.
The new screening instrument being implemented is a checklist. It will be replacing the BH1 assessment currently used in the DCFS system. The new screen has been named the TBH, or Traumatic Behavioral Health Assessment, to reflect this screen's emphasis on covering traumatic events. The TBH covers all possible types of traumatic events.
It also covers 10 PTSD items, since PTSD is the core psychological issue for traumatized children. Finally, it also covers co-occurring problems like depression, anxiety, oppositional defiant disorder, and ADHD. This is because PTSD is actually just the core issue. When people have the diagnosis of PTSD, about 80% of the time, they have at least one other co-occurring or comorbid psychiatric diagnosis. Some of the time, these comorbid disorders were there before the traumas, and some of the time, these comorbid disorders developed after the trauma, the same time as PTSD developed. That's why it's important to cover all the possibilities, and the TBH is designed to do just that.
As the caseworker, you should hand out the TBH to every child in your caseload. It should be completed for every new case and then re-administered every 6 months to each child to help identify any new trauma that may have occurred. The TBH is comprised of 56 items and is designed to be self-administered. There are 2 versions, one for caregivers and one for 7 to 18-year-olds to fill out themselves. When a child is under the age of 7, only the caregiver will fill out the TBH. When the child is age 7 or older, they will fill out the child version of the assessment, and their caregiver will also fill out the caregiver version. We will be collecting both forms. Sometimes a 7 or 8-year-old will not be able to fill out the TBH on their own. You can use your judgment on a case-by-case basis to see what works best with each child.
If a parent or child has trouble reading or understanding the questions, you may need to walk them through the TBH yourself. It's important to be familiar with the measure in advance so you can anticipate potential questions. To administer the screening instrument sensitively, be sure to speak as calmly and matter-of-factly as possible. Remember that talking about their trauma is often difficult for people. Sometimes you might get asked what counts as trauma. Remember that trauma is something that is perceived as a life-threatening event. It does not include things like chronic neglect, divorce, or watching violence on TV.
The next thing I'd like to do is have you fill out a questionnaire that we give to everybody. This will just help me learn some more ways that we can help your child. It includes some questions that covers traumatic events, so it might be kind of difficult to answer, but I'd like you to just try your best to answer as many as you can. The first page is about trauma events. Mark in this column if the event has ever happened, if you know how old he was the first time it happened, the last time it happened, and about how many times it happened. You can write that in here. The second page is about symptoms of post-traumatic stress, and the last page is about other things like depression and disruptive behaviors. So for each question, just try and choose the answer that you think fits him the best. I'm going to work on some other paperwork while you're doing this, but let me know if you have any questions.
Do the same thing when you administer the screening instrument to 7 to 18-year-olds. By the time you administer the TBH, you will have spent some time getting to know the children in your caseload. You may know which children will need help regarding and understanding the questions.
If children become upset while filling this out, empathize and ask them if they'd like to continue or not. Remember, some distress from reminders of traumas is part of PTSD. If being reminded of their traumas by these questions is upsetting, it's likely that they have these upsetting reminders much of the time. It's important to remember that you're not causing new memories. Most children understand that you're trying to help them.
Any distress the child experiences should be temporary. If distress continues, remove the questionnaire and do things you would normally do to comfort the child. Remind the child or their caregivers they have your office number to call if they need assistance after you leave. Please take a moment to check the TBH thoroughly before ending your visit with the client to be sure that it is complete.
Check to see that they have answered every question on the checklist. If a question has not been answered, point it out to them. Also, sometimes people will circle 2 answers for a question. If this occurs, you should use the higher of the 2 scores when entering the results in the database. You should also check over every answer to make sure that no red flags have been raised that could be cause for immediate attention. Also, note that the last 11 questions on the TBH are related to dangerous behaviors, psychosis, substance abuse, autism, and preschool conditions.
If any of those last 11 questions have been answered yes, that is probably cause for follow-up questions and for a referral if the child is not already in treatment. If follow-up questions indicate that a child is unsafe, the caseworker should consult with their supervisor regarding the agency's protocol for crisis intervention.
Asking these questions can be difficult, but it is very important. The effects of psychological trauma have been recognized for decades. Professionals of all types have been silent for too long by not asking children about these issues. Children who have been through traumatic experiences usually are not going to volunteer to talk about these things because avoidance of reminders is actually part of the syndrome. In my experience with over 500 children of all ages who have PTSD, most children appreciate that someone asks them about their problems. Most of the time, I can tell pretty quickly by watching someone whether they have hyperactivity or depression. I can't tell who has PTSD just by looking at them. Their symptoms are not obvious, like depression and hyperactivity. Their scars are hidden. This makes trauma-related problems harder to detect and is one of the big reasons we need this project.
How is PTSD different from other problems? First, many of the symptoms are internal to a person, and we can't see them easily on the outside. For example, avoidance of thoughts or feelings associated with the traumatic events is something that goes on inside a person's head. Children may have nightmares and not tell their caregiver. They can feel distant from loved ones but not know how to verbalize that to their parents. Many of the symptoms are only present when they're confronted by reminders of the traumatic event. If they're successful at staying away from reminders, the symptom may not appear very often. Unlike any other psychological problem, avoidance is part of the disorder of PTSD. People who have experienced trauma don't want to remember what happened to them. They would rather forget what happened. So to ask them to think about their symptoms is to make them remember again. Many children will try to avoid talking about their symptoms because they don't want to remember their traumas.
If children persist to have symptoms for more than 1 month, they need professional counseling. PTSD reactions are not like bad memories or cuts on your skin that go away with time. PTSD does not go away on its own. It takes treatment.
Fortunately, very good treatments exist for PTSD. These include cognitive behavioral therapy, or CBT, eye movement desensitization and reprocessing therapy, or EMDR, and sometimes psychodynamic therapy. The most commonly recommended therapy is CBT. Given the right treatment, the vast majority of people can expect tremendous improvement. Once the client has completely filled out the assessment, you will be entering the scores into a database. When entering the information for older children, you will be recording the responses from the version that the children filled out and the version that the caregivers filled out. At times, it may be possible that the caregivers and the children have reported different answers and have significantly different scores. This is because research shows that children and parents tend to report different kinds of information. The children know more about their internal feelings, whereas the parents are usually more accurate about reporting externalizing behaviors. We don't expect for their scores to match, so the results page will calculate a third score, the joint score. The joint score uses the highest score of either the child or the caregiver. The results page will prompt you if you ought to make a referral.
In order to further document your case planning, you will also notice that when this data is added to FATS, there will be a referral checkbox for you to mark. You should check this every time you make a referral for a client. Just mark yes or no.
Of course, the TBH score is just one piece of information that you have when deciding to make a referral. Even if the score itself does not suggest that a referral is needed, you should always consider all the other information you have when making the best decision for the client.
If the children's score from the TBH indicates that they need referrals for treatment, it would be ideal to refer them to providers who specialize in an evidence-based treatment that has been proven effective for those suffering with PTSD. Research supports the use of CBT as a good method to help children recover from trauma.
The goal of this project is not only to identify the kids who need treatment, but also to help reconfigure and improve the services being offered to them. That's why Tulane is offering clinicians across Louisiana free training in cognitive behavioral therapy, or CBT, for PTSD. We're training clinicians to conduct a 12-session manualized course of CBT for their clients. There are 3 essential elements in the treatment of trauma symptoms. We want children to learn to emotionally engage with their trauma memory, to organize and articulate their own story of the traumatic event that happened to them, and then finally, to learn how to modify their beliefs about the world and themselves to reflect a healthier, more stable outlook.
The youth who participate in this therapy will learn relaxation techniques that they can help to calm themselves and gain a measure of self-control over their scary feelings. They will see, over the course of their sessions, how they can cope with the negative feelings that they are experiencing related to the trauma.
The children's caregivers should be present for every session. For the younger children, they help them do assigned homework every week, based on the weekly goals that the therapist helps them set.
Tulane University School of Medicine is providing clinicians in Louisiana free training in the use of cognitive behavioral therapy. They will also be aware of the goals of our project and the implementation of the TBH.
Since the information that you will be collecting with the TBH is so valuable, we want to make sure that it is a tool being shared with the provider when you make a referral. Let clinicians know that you can provide a copy of the TBH to further inform their treatment plan for the child.
Tulane staff is also on hand for workers in the DCFS system and stakeholders in the community. We will be there to help, listen to feedback, and troubleshoot as the new screen is being implemented.
The incident happened to me was 15 years ago. If it's still affecting me and my spirits are pretty high most of the time, I think it'd be affecting a lot of kids. If I was to take the TBH today, it will make a huge difference in my life. Any child that needs it, I think it will make a difference in their life. I truly believe that.
For more information and to contact us, please visit our website at latrauma.tulane.edu.